Hi, I'm Dr. Lisa Simpson, President and CEO of AcademyHealth. Welcome to our Future of HSR interview series. As AcademyHealth celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. Today, I'm talking to Dr. Beth McGlynn, Senior Vice President for Research and Quality Measurement at Kaiser Permanente and Professor at the Kaiser Permanente Bernard J. Tyson School of Medicine. Thank you so much for joining me today, Beth. And I will call you that throughout. I am excited for our discussion. So let me start by sort of acknowledging all that you have done, Beth, for and with AcademyHealth over the years. You've served on our board of directors. You were the board chair, in fact, the board chair who recruited me, and you are a recipient of the AcademyHealth Distinguished Career Award, really our highest award. Can you talk a little bit about your involvement with us over the years and how you've seen the organization evolve over our 40 years?
So, the evolution of AcademyHealth is the same as my professional evolution. I'm pretty sure that I was at the very first annual research meeting, which was held in a very small hotel conference room. It wasn't even a ballroom. You could sort of lay eyes on everyone at the beginning, and the luminaries in the field, which I now realize were about probably 10 years ahead of me career-wise, were easily accessible. And so it was the beginning of my career. And, what an evolution. I mean, it's a huge organization today. We could, we need convention-sized rooms to bring people together. And just the contributions the field has made are remarkable, and in their range and in their importance. Everything from, policy work that has influenced, important things like the Affordable Care Act, to work I and others have done in the quality of care space that I think has made a difference for patients throughout both our country and internationally. To public health type things. I think it's kind of remarkable the impact that the field has had.
Thanks, Beth. And I want to pick up on one of the areas of action and impact that AcademyHealth in the field has been active in over the years, and that's quality of care. And, importantly, I want to acknowledge your role as the first author of really a seminal work that was published in the New England Journal in 2003, where you found that just half of the adults living in America were receiving recommended standard care. And so that was a major wake-up call, this documentation of just how often we fall short. And so as you think about that piece of work and the time since, we're almost at 20 years since that publication, that'll be next year. What progress have we made there? And what does the field need to do? How can AcademyHealth further support the research and the implementation we need for better quality?
When I talk about this work, I always go back to, where it started, which is something I think any soft money researcher will appreciate, which was I had to convince people, funders, to support even studying quality of care. And early on, the reaction I got from funders is, we don't have a problem with quality in the United States, so I don't understand why you'd want to study that. And we went through quite a bit to actually get to the point where we could get sufficient funding to do the study that was published in 2003. And, I think when we found that, and the finding was that American adults on average were getting about half of recommended care for the leading causes of death and disability. And we subsequently published work that showed that this was true for children. In fact, children were getting even less. It was more like 47% of recommended care. I think that was a big wake-up call, and there was a recognition that we had a problem, and it contributed to a number of things, some of which I think probably require a reset. So it definitely led to much more measurement of quality, standardized measurement of quality. It led to public reporting of quality performance at the hospital level, at the health plan level. It's led to pay for performance programs that try to incentivize systems and providers to deliver necessary care. And I think we're now at a kind of another inflection point here where the opportunity in the field is really to take a step back and ask whether we need some new approaches. And, I've published with other members of AcademyHealth some ideas about where we could go with that, which I think is to become much more person-centered in the way we think about what constitutes quality, to be much more integrative. But the field is totally capable of rising to the challenge there. And I hope that in 20 years we'll see more progress than I feel like we have seen. We have seen progress, but it's been not as consistent and not as sustained as I would have hoped.
So, Beth, one of the aspects of that seminal report and why it had the impact it did was not just the findings, but also how it was communicated, and that emphasis on making sure that it was appropriately brought to the audiences who could act on it. How can researchers do a better job of taking on more of the communications part and not being satisfied, so to speak, when the journal accepts the article?
For me, one of the big kind of hallmarks of the success of that work was, and actually I was at an annual research meeting for AcademyHealth when it was published. I opened up my hotel door in Nashville. USA Today was on the sitting outside my hotel room, and I picked it up, and above the fold was the headline, American adults receive half of recommended care. And you don't really need to know what quality is to know that's bad, and to know that that's at odds with what we might expect or think would happen in the country. So above the fold, in a publication that reached a lot of the general public. Didn't happen by, accident. The funder of that work, the Robert Wood Johnson Foundation, actually engaged a media team. It was the first real serious media training I had gone through. We worked a lot on how to communicate that, but we also had research that was easily translatable to folks. But did a lot of work to try to connect the dots to make this broadly accessible to people. And a lot of the work I do today with researchers inside my own organization is to help them translate beyond kind of talking at a scientific conference to people who really can act on what they're finding, but they need to get out of jargon and they need to be a little less interested in methods and data, data issues, and focus on what does this mean? The so what? Do you know what I'm saying? And I think that takes training, and I think it's a separate kind of training than the work that lets you do really strong scientific work, which is absolutely essential. We need that to be the foundation, but the ability to talk about that with folks who aren't themselves scientists. And I think what I'm seeing with the younger generation is a lot of excitement around that opportunity. I think that's why people come to a lot of non-academic systems to do work, is the idea that they may be able to more rapidly translate what they're learning into change in an organization or to change in policy. So I think that is something we just need to work more actively on.
So looking ahead to the next 40 years of our field and of AcademyHealth, what do you think are the most important areas of emphasis for new and just emerging research leaders? And how can AcademyHealth help to spur, drive, nurture progress in those new and different areas and with those new and different researchers?
One of the areas, I think two areas that are emerging that are not unrelated, that I think will require a lot of energy, are the role of social factors in charting a course for somebody's health from early on throughout their lifetime. And the other is the issue of equity. And obviously those are highly related concerns, but not identical. And so, I think one of the things that the one area of importance for the field is in some ways to take one more group of questions into what's already a fairly complex set of questions, which is how do we think about the broader context within which people work, live, and play, and its role in shaping their health, and how can we make sure that that people can be as healthy as they would like to be, and that we make that possible. And a lot of that happens outside the healthcare system. So, without losing the importance of health services, the essence of health services research, I think that opportunity to think about how do we integrate these broader contextual concerns will be important. And I think, as we look at the equity area, there will be opportunities to think about how do we dismantle structural racism that is a policy concern, just like other kinds of policy concerns. It's not just how do we pay for healthcare, but how do we dismantle some of the things that really fundamentally get in the way of people being able to achieve the health and wellness that they want for themselves. So those are some of the areas that I could see being important for Academy Health in the future.